Thank you everyone for joining us for the Sustainability Day of Action. This is our flagship event at Sustainability Partnerships, and it's the second day of action that we've done. This is also actually our 15th event that we've done since Nathan, my business partner here, if he gives us a wave, and myself took over Sustainability Partnerships and rebranded and got it to the place it is today. So we're really excited to be, for our flagship event, to be the 15th one that we've done so far. We do actually have a pledge page. One of my support staff will put that into the link into the chat function, and we would love for everyone just to put in their own sustainability pledges. I've put in my own. Mine was around eating more locally, sourcing more local food, eating more sustainably and seasonally. To be honest, if there was any call to action on there around food, that was the one that I was going to be going for. But you can come up with your own. Everyone, please come up with your own sustainability pledges on that page. It'd be great to see everyone's feedback. Now, we do have an amazing lineup, and we do only have an hour and a half. So I'm going to give you a quick rundown of who we have on the call. If everyone can just give a quick wave when I shout out your name. We've got Richard Hixon, who's going to be talking about human healthcare and the ocean, as you can tell from his background. It's quite on point. We've got Annalisa, she's going to be speaking about a case study, 5-step framework for a net zero carbon supply chain. Then we've got James Bate. James is going to be talking about how to engage the ICS green plans. Then we've got Dr. Ben Rusholme, who looks as though he is coming to us straight from his surgery. So we really appreciate you giving up your time. Ben, who's going to be talking about sustainable primary care. And then finally, we've got Susie. I didn't get your talk title yet, but you will be able to just introduce that yourself if you don't mind. So what we're going to do is we're going to jump straight in with Richard. I'm going to be jotting down some notes and some questions. Everyone's using the chat function as much as possible already. I know that you guys always do, because you're just such a great and engaged audience. But if you've got any questions, feel free to add them to the chat or the Q&A function. We'll have a great Q&A at the end of this session, and I'll pose all of your questions to our speakers then. So without any other intro, Richard, please take it away. Let us know who you are, what you do, and a bit of an intro to your presentation today.
Yeah, hi, thanks, Georgia. Hi, everyone, and happy World Oceans Day. My name is Richard Hixon. I'm a critical care consultant in the northeast of England. I've got a number of sustainability roles that range from local through to national and increasingly international, because the oceans have no boundaries. And I'm going to talk about how human healthcare is damaging our oceans, how these changes are occurring at an unprecedented rate, but most importantly, what actions we can and must take to reduce this oceanic harm and help mitigate the effects of climate change as well. This will be quite a fast talking presentation. This is normally about 20 minutes. So I'm going to kind of shoot from the hip, and I am going to present this in 10 minutes. So my interest in this came about as a critical care consultant when I just realized I was using a heck of a lot of stuff, single-use plastics, pharmaceuticals, energy, etc. I became interested in where this was coming from, the effects of its manufacture, its distribution, its use and its disposal on the oceanic environment. This is just an environment I've been fascinated with since childhood. I mean, the Yangtze River dolphin shown on the screen here was my favorite marine mammal when I was growing up as a child. I mean, just look at it, it's beautiful, absolutely stunning. And it became extinct in 2006 due to the industrialization of China. It only existed in the Yangtze River. And I was absolutely gutted when I heard this. We've all heard the familiar narrative, fossil fuel output, carbon output is going up, CO2 is going up, but we don't hear about oceanic acidification nearly as much, but it's at least as important as the rising CO2 in the atmosphere. And the oceans are acidifying at a rate never seen before in the history of the Earth. Basically, we've dropped about 0.13 units in 150 years. That's a 33% rise in hydrogen ion concentration, and this is causing harm around the planet. This point of acceleration is about 1950, and this is a really, really critical point. It's known as the Great Acceleration, and it coincides with the increase in the use of container shipping. The first shipping container was shipped in 1956, and the numbers have gone up year on year on year. And this is because the human population has tripled. We've become a consumptive society, and that consumption includes healthcare, and where there is consumption, there is also waste. The civilization we have today is purely down to the fact we've had climate stability for 11,000 years since the last ice age, and this stability has now been completely broken. I mean, certainly since 1850 and 1950, we have seen this absolute exponential rise in atmospheric CO2. That's just one parameter that we measure, but the most common one we use to articulate the instability that we have introduced into the Earth's ecosystem. There are many, many other parameters. We can look at socioeconomic trends, Earth system trends. They are all increasing dramatically. And if you plot the number of McDonald's restaurants, it follows the same pathway. From my point of view, we see the oceans represented here as well in ocean acidification, coastal nitrogen. But if you look at the marine fish capture one here, this is an extremely worrying one because it goes up and then it plateaus. And that's a reflection of the fact that the oceans are running out of resource. Ocean acidification is described as climate change's evil twin, and it is extremely serious, but it is not talked about. But it is responsible, along with warming, for the destruction of coral reefs worldwide on an unprecedented scale. And if this was land-based vegetation or organism loss, it would be on the news every single day. But because it's underwater, we just don't hear about it nearly as much. But ocean acidification is a common feature of all 5 previous mass extinction events, including the end Permian 250 million years ago, which saw the loss of 96% of all marine species. Most worryingly, we are seeing ocean acidification occurring faster than the epoch preceding the end Permian extinction. So this is extremely serious. The oceans are amazing. They absorb 90% of the heat that we have generated through global warming. So if it wasn't for the oceans, we'd be looking at not 1.5 degrees C, but 5, 10 or 15 degrees C. They produce 50% of the Earth's oxygen every other breath we breathe, and they store 40 trillion tons of carbon. That's 16 times more than land and 50 times more than the atmosphere. They give us so much, but we give it so little back. We give it our carbon dioxide, or we give it a lot back actually, it's just none of it's positive. We give it our carbon dioxide, which acidifies the oceans. We give it the heat energy. We give it agricultural land runoff, phosphates and nitrates, which cause hypoxic and dead zones. We cause physical destruction through building and drilling and mining. We collide with marine mammals when we use the ocean because we're a little bit inconsiderate. We transfer non-indigenous species all around the world in ship ballast water. We give it untold amounts of waste and pollution to deal with, and we also give it pollution in the form of underwater radiated noise. And this isn't talked about a lot, but it's very serious because we are a very noisy species, especially from the perspective of these whacking great container ships, which are delivering not only our iPads, but also our healthcare supplies. And this has deafened the many marine species over the last 70 years. And they use their ears, like we use our eyes. They use it to find food, to avoid prey, to find their mates, to reproduce, look after their young. So this is an extremely important aspect of pollution that is often overlooked. This is a blue whale trying to feed in a shipping area off the west coast of Chile, trying to avoid ships going in and out of port. It is extremely dangerous for these animals as the human population has increased. And closer to home is the Bay of Biscay and the North Sea, very busy shipping area. These map markers are all ships. And it is also a critical ecosystem for many species, including the fin whale, the second biggest animal that's ever existed on the planet. And as these ships go through this critical ecosystem, every year, 20,000 of these creatures, not fin whales, this is cetaceans in general, are hit and killed by ships. Whales are just one species, but they are a huge carbon capture mechanism. They capture huge amounts of carbon over the decades or hundreds of years they live. The bowhead lives up to 200 years, and this sequestration capacity is lost when they are killed prematurely. But also, these are intelligent animals. They live in societies. They're not a what, they're a who. And when a ship strikes one of these and drags it along its bow until death, the suffering must be immeasurable. And this is just absolutely catastrophic on a moral level. But also the whales are, again, one species, but they are ecosystem engineers, and life in the oceans cannot exist without them. They fertilize the photic zone, which is the surface zone of the oceans where the sunlight permeates. And this allows all organisms, including the very smallest phytoplankton, to exist. This is Prochlorococcus, one of the many, many phytoplankton that exist in the ocean. 60% of all ocean life is less than 1 millimeter in diameter, and they need phosphates and nitrogens provided by whales and other means in which to survive. Prochlorococcus, along with diatoms and coccolithophores, capture huge amounts of carbon through photosynthesis. But most importantly, there's 1 billion tons of these in the ocean at any one time, but they are replenished every single 8 days. That's 45 billion tons of photosynthesizing organisms being produced every year. These are fed upon by zooplankton, which in turn, as night falls, they are fed upon by creatures from the mesopelagic zone, 300 to 400 meters down. 5 billion tons of creatures migrate up to feed on these small organisms. It's the greatest mass migration on the planet. It happens daily, and this is what keeps us alive. The small organisms photosynthesize, these larger organisms feed on them, and they drag the carbon down into the depths of the ocean. These crustaceans, these copepods and other organisms move more water vertically every day than the moon does through tides and gravity. All these marine creatures, when they feed, are fed upon, die, and they poo as well. And all this stuff falls down into the deep oceans as marine snow. And this is how we sequester carbon in the oceans, which arises originally obviously from ourselves. It goes into the atmosphere, it goes into the land. And you'll see down here, there is a significant portion that goes into the oceans. But we've lost 50% of our photosynthesizing biomass over the last 70 years. So this number here, it is going down all the time. And if we hadn't have poisoned our oceans and turned it into this chemical soup, then we may very well have more in the way of photosynthesis and less in the way of climate change that we see today. So we cause damage to the oceans through, as I say, all these things that arise from ships, the underwater radiated noise. They produce about 1 gigaton of CO2 every year. They lose containers overboard, thousands and thousands every year that contain God knows what. They also have discharges from bilge tanks that contain oils. We then, through healthcare, provide lots of macro and molecular pollution in the form of pharmaceuticals, metabolites, our forever chemicals, and microplastics. One source of microplastics people don't realize is brake and tire dust, which gets washed down into drains and then into the oceans. This is the second most common source of microplastics in the ocean, and we get increasing amounts of tire dust from electric vehicles, which are heavier than their fossil fuel counterparts. So just something to think about there. We also find these microplastics ending up in the food chain. They get it into all sorts of stuff that we eat, and microplastics have now been found in human blood. We do not know what these do, but we doubt it will be positive. And if we just look at the prediction of what all this waste pollution and acidification is causing in the oceans, this is the amount of plankton, fish, whales, and carbonate-based life. This is the predicted pH value as business as usual. In about 2045, we get to a decompensation point where the oceans are too acid for these carbonate-based life forms, and they will simply go into a death spiral. This ecological space will be filled by dinoflagellates. These produce toxins that will poison the oceans further, poison the atmosphere, and then the land. And we're then not talking millions of deaths, we're talking billions of deaths. So this 2045 is something that's certainly on my mind. We're not short of imagery and narrative to kind of see what we're doing to the oceans. We're competing with other big stories though. In 2020, cake was mentioned 10 times more than climate change on television. So, you know, we're really up against it with respects to the media. The NHS, we know, will be impacted upon all these things until it breaks. And if we want to reflect on COVID-1 virus almost broke the NHS. Climate change is multiple viruses, bacteria, protozoa, heat-related illness, flooding, trauma, you name it, you know, warfare, malnutrition, you know, this is going to be a very serious situation. So yes, we need to stop our emissions. Yes, we need to stop deforesting. We deforested 10 million hectares in the tropics alone during COP26 year. This equates to about 500 million tons of sequestration capacity. To put that in perspective, that's 20 times the NHS output, including all its supply chains. So NHS net zero is kind of, we still need to do it, but if we take it in context with deforestation, we really are up against it here. Land-based use, yes, there is considerable sequestration capacity there, but we have a rising population. Tech, well, tech promises a lot, but so did the White House in 1979. It promised we could tech our way out of the CO2 greenhouse effect. I would, on reflection, say that that's absolute rubbish. That's 1983, and CO2 has gone up year on year on year. And I would argue the buy it now button and cryptocurrency is causing us more trouble than it's solving. However, as you can see, the CO2 oscillates year on year. This is the Earth breathing in and out as the Northern Hemisphere loses and gains its leaves in autumn and spring. But what this shows us is the hope within natural systems. Natural systems can absorb enormous amounts of CO2, much more than we produce. We've just got to make them healthy, and that's all parts of our natural systems. So driving change through healthcare, yeah, we've got NHS Net Zero, we've got the powerful policy procurement note 620, wonderful document. We see this now distilled within social value guidance and the soon to be released evergreen supplier framework. And to enact all this, we need to influence our supply chains. We need to influence the shipping industry. We need to make sure that we move our goods around the planet in the best way possible. Shipping is here to stay. It is the most environmentally friendly way of shipping stuff around the world. So we need to engage with them and reduce the harm being produced. We need them to sign up to initiatives like COZEV. Please Google it. We're on with that one, by the way, through Healthcare Ocean. We need to engage with all our suppliers, our manufacturers, our distributors. We need them to understand the place of the oceans in a healthy ecosystem. We need them to have blue plans in addition to green plans. We need to educate, communicate, bring nature into the conversation. We can only survive on this planet with healthy natural systems. And just for one example, Alderhay Hospital, I mean, just looking at that, I want to go and work there. That looks fantastic. And not only is that good for nature, it's good for patients. So actions, drive less. This is actions we can do on a personal and a professional basis. Drive less, including electric vehicles. Electric vehicles are not the solution. We've got to move around less because of the reasons that I've already said. Consume less, whether this is personal or professional. We've got to stop this linear consumptive society. We've got to think about what chemicals we use, including sunscreen, stop putting them into the environment. Choose not to cruise. These are container ships with a disco. They go to nice places around the world and they pollute them. So please don't cruise. Charities, some of them are amazing, the smaller ones, which are really focused on environmental protection and improvement, and get the crap out of the system. Go out and collect litter, get it into the municipal waste. Municipal waste may not be perfect, but it's a damn sight better than it ended up in this river, which is just down from where I live. And this is some of the stuff I pull out on a regular basis. From a hospital point of view, this is the beautiful architectural achievement of Darlington Memorial Hospital. You can see our two trees there. There's one on the left and one on the right of the sign. And we can actually make many of these changes as well within our hospital environment. Ambulances, electric ambulances or hydrogen-powered ambulance is great, but let's collect the tire and brake dust as well. We can reduce our consumption, and obviously we've got to think about how we dispose and use of pharmaceuticals. So this is Healthcare Ocean. We are doing our best. We are a very small, perfectly formed group that try and speak as often as possible to raise the oceanic profile at human health, within human health. This is our website, Twitter, Facebook. Please join us and let's go save our oceans. Thank you very much.
Thanks, Richard. It's a great way to start the session off today. Really enthusiastic, full of so much detail as well. I think that what we've found since running sustainability partnerships is that the mission that we have in front of us is so unbelievably multifaceted that every time we come up with a new topic of conversation, we're still just scratching the surface of that topic alone, and there's still another million to talk about around that, but that's super detailed, loads of interesting facts and just things that really hit home. I loved dolphins as a child. I can't imagine a child that didn't love dolphins, but I think that we, as you say, out of sight, out of mind, isn't it, the ocean floor. So yeah, really appreciate all of your enthusiasm and your super well-researched and insightful talk there. If anyone does have any questions, as I say, please put them in the Q&A function here. We've had loads of people chatting and saying hello and introducing themselves in the chat function. So really appreciate everyone having your own discussions there. We're going to move on to Annalisa, please, if you can share your screen, give us a bit of an intro to who you are and where you work and what you're going to be speaking about today.
There we go. Can you see and hear me, Georgia? Yeah, thanks very much for that introduction. Wow, Richard, thanks so much. I have seen Richard's presentation many times and it always gets me. It's just so fascinating and informative. And I also remember the day that they announced that the Yangtze River dolphin was extinct, and I was also absolutely heartbroken on that day. I just love your passion and enthusiasm, and yeah, fantastic. And actually, like, yet another conversation with you, Richard, about how we can link up our projects, because I'm going to talk about supply chains, and everything you've talked about there is an opportunity for us to influence NHS supply chains. So much to take in from your presentation and a hard act to follow. But I'm going to give it my best. And I'm also going to have to speak very quickly because I also have a lot to cram into 7 minutes now. So I'll try and do that as quick as I can. And that's going to be difficult for you guys, my Northern Ireland accent, to follow me, but we'll give it a go. So I'm going to talk about a case study of what we're doing at Newcastle hospitals to engage our supply chain and increase sustainable procurement. So first of all, one slide on why we would do that. Well, we have 3,400 suppliers to Newcastle hospitals, and those suppliers are of all shapes, sizes, sectors, etc., but they're all facing multiple pressures. So obviously quite a few from the NHS itself, which has set a net zero target that the Footprint Plus, including the supply chain, will be net zero by 2045. And there are trust-specific versions of those targets. So at Newcastle Hospital, we've actually set a target for our Footprint Plus to be net zero by 2040. So 5 years ahead of the NHS targets. There's also the NHS net zero plan, which is requiring suppliers to align to NHS targets, with the statement that by 2030, the NHS will no longer buy from any supplier that hasn't published its own net zero target. The NHS central team have brought in the supplier roadmap and the evergreen framework, and we've worked very closely with that team and had several conversations with Alexandra Hammond and made sure that our project supports and aligns to what the central team are doing as well. But outside of the NHS, there's even more drivers. There's financial pressures, there's the government procurement, the Social Value Act, which requires 10% of all procurement evaluations above 5 million to consider social value added, as well as the PPN 0620 and 0621, which I'll mention. And then there's legal requirements. So all large businesses, as defined by the Companies Act, more than 250 employees, more than 36 million turnover, 18 million on the balance sheet. Any business that hits 2 out of 3 of those criteria has a legal requirement to publish its carbon footprint, as well as the ever increasing stakeholder expectations and the moral expectation that we address the climate emergency. So if that's not reason enough of why suppliers need to take this seriously, we thought we would try and develop a simple 5-step framework to support our 3,400 suppliers. So I'm really pleased to be able to say that we have over 700 suppliers already engaged in this framework, including large suppliers like Johnson & Johnson and Draeger and Vanguard and NHS BT, but also lots of small, medium, micro businesses like Anyone Logistics, Zmove, Potts Prince Firm. So hundreds and hundreds already engaged, which we're really, really thrilled about. And the simple process that we're asking suppliers to follow is these 5 steps. So step 1 is we've sent out a survey to suppliers and we've asked them to tell us their views. We're then, step 2, offering a portfolio of different support options to try and help suppliers. I must stress, we're not saying that we know everything. We don't have all the answers, and we're not saying that we've got it cracked. We certainly haven't, but we're all in the same battle here, and we do feel we're stronger if we collaborate and work together. So part of step 2 is actually encouraging collaboration within the supply chain. We're gathering case studies, we're sharing best practice. And step 3 is asking suppliers to actually measure their performance and report that to us on the free platform, and then publish their net zero targets, which, as you saw on the previous slide, is a requirement anyway. So step 4 is an NHS requirement anyway, and step 5 is publish a carbon reduction plan, which again is a requirement of PPN 0621 in any case. So very quickly through each of those steps, which I'll just rattle through. Step 1, as I say, we've had 750 responses. This is our 2nd year running it. Last year we had 499, so we're thrilled with a 50% uplift in engagement in year 2. And yeah, getting some interesting insights, so we can see we're getting responses from suppliers of all sizes. But interestingly, 30% of them are micro businesses with 10 or less people employed. So we've got to have a solution that's fit for purpose for all sizes. But, you know, a fair amount of medium and large organisations as well. Only 2% of those large enterprise businesses engaged in our platform, but those will be the ones that are working directly with the NHS Greener team on their CDP requirements. We've also asked what sector, using the E-class codes, we've asked what sectors they're from, and you can see we've got a good spread, but the majority coming from medical, surgical equipment, building and engineering products and services, laboratory equipment. But we're trying to reach out to everybody, all sectors, all sizes. And the great news is that there's a really high level of support for our project and what we're doing. So 87% support our goal to be net zero by 2040, which includes suppliers. So they're supporting that ambition. A few not sure, which I think is understandable, but only 1% not happy with that ambition. Of those that have opted in, obviously, and also a very high level who are happy to measure and report their carbon footprint. Interestingly, though, nearly 30% of no plans to publish a net zero target and no plans to publish a carbon reduction plan. That, to me, maybe is perhaps a lack of awareness and understanding, because those are actually requirements. They need to publish a net zero target to be working with the NHS after 2030. So they need a plan to publish one. And PPN 0621 requires a carbon reduction plan. So there's an education piece there, which leads into the next bit, which is we've offered suppliers an information pack. We've offered them a free webinar, and we're offering an ongoing website actually with uploaded case studies. So again, a really high level of suppliers interested in that. And what our suppliers have said, just some example quotes, been really encouraged by this. We thought there'd be much more pushback, had 1 or 2 concerns, but the vast majority of suppliers are saying we're really welcoming this and thank you for supporting it and taking a positive position, even from the small businesses. Step 2 is our webinars, which are coming up at the end of this month and next month. Anybody can sign up for those. They are free. We've got over 300 bookings already across the 3 dates. It's the same webinar repeated 3 times. And we're also offering this free information pack out to suppliers that request it, which includes a glossary and an FAQ section. The webinar will offer training on carbon footprinting and explain how Scope 3 Category 1 purchase goods and services is actually part of our wider footprint and why we need their data for that. And anyone that attends gets a certificate. It's a 2-hour session, but we do signpost people to the longer courses that are available by the local university, IEMA approved courses. So there's a 1-day and a 2-day version there. I'm rattling on through this because I can see my time's nearly up. Then step 3 is measure and report your carbon footprint. So we are using a platform at Smart Carbon at Newcastle Hospitals called Smart Carbon. I must declare the conflict here in that I work part-time at the NHS, but Smart Carbon is my business. I launched in 2016, but we obtained some funding. This is at no cost to Newcastle Hospitals, and all conflicts have been declared and managed. But we find it a really useful tool for measuring our full footprint, everything from our direct footprint, our direct energy consumption, our indirect energy consumption, and our footprint pluses on there. It does have the facility for the current spend code methodology, where we look at how much we spend each year with supply chain, with the suppliers, and multiply that by a nominal tons of carbon per pound spent, which gives us that blue section on the bottom bar chart there. But obviously that methodology is problematic. I haven't time to go into the detail of why it's problematic, but we're moving away from that to real data from suppliers, which is why we have set up this supplier dashboard, and we've got suppliers reporting their their performance directly to us. Many of these suppliers already measuring, already have this information, in which case they can just plug it into the free reporting page. They just plug in their tons of carbon, scope 1, scope 2, their FTE, their turnover. And because they give us their turnover and their value of sales, we can proportion out their footprint, their scope 1 and 2 footprint. We'll assign a proportion to us. And if they're supplied to multiple trusts, they only need to fill that. You go on the platform once and fill this in once. There is an option for suppliers to upgrade to the full account, and they're eligible for a discount if they do that. And that's if they need more help and support to actually come up with the answers of the carbon footprint. The information pack signposts them to all the free resources out there, the government factors. We're not requiring anybody to spend anything, but we are signposting them to tools if they need them. And the full account will give them therefore access to all of the full functionality that we have access to, producing all the graphs and reports and SDR compliant outputs. But ultimately, all the results are pulled together in one dashboard, which means we're aiming to next year produce a carbon footprint where an actual wedge of our supply chain is actual data reported from suppliers, because only then will we ever have any hope of getting to zero, because we're never going to spend £0. In fact, our supply chain emissions are going up. Inflation is adding to that problem. So the only way we'll ever do it is if our suppliers are on a net zero charity too, which we'll be able to track on that dashboard. So step 4 is we're asking them to publish their target. That's also in that free reporting page. They just simply say if they've got a target and what date is it. We'll see that on the dashboard. Step 5 is we're asking them to publish a carbon reduction plan. Again, we simply ask them, have they got one? There's a place for them to upload a hyperlink to it. And we're signposting them to the template that the government require companies that are providing to public procurement via PPN 0621. And we signpost them to resources like IEMA's greenhouse gas management hierarchy for developing a carbon reduction plan. So take a breath. To conclude, this is optional. We're not mandating this for any suppliers yet, but by 2030, they must have a carbon reduction plan as a net zero target published as required by the wider NHS. So we just thought we'd put this framework in place to help them get to that place by 2030, but we can't get to zero without supplier engagement. There's a host of other benefits, and collaborative working definitely we believe is important, and we're getting really good feedback. I'm very happy to share any of our documents, our surveys, our slides from our webinars, anything that any other organisation might be interested in. And if you're interested in the platform, go directly to Smart Carbon for that. And yeah, that's my final slide. Thank you very much.
Thanks, Annalisa. That was real quick as well, but I hope that everyone was able to take everything in there. Just a few reminders that the session is being recorded. We will have a full write-up on the Sustainability Partnerships website with the recording and all of the resources and links to all the slides. Everything will be available, and it will be sent out to our entire database as well, so everyone will have access to it. And I just wanted to sort of echo some of the things that you were saying there, Annalisa. It's exactly the same for sustainability partnerships. We're here entirely for the, that collaboration and knowledge sharing, exactly what you guys are doing. So another thing that I wanted to bring up, if anyone does want to collaborate with us on any social media posts, if anyone within the NHS is doing anything interesting, like you've got webinars, you want us to help promote those things, you want to support with the blogs, any content, everything's always free for the NHS to get involved with sustainability partnerships. All of our webinars are free to attend, and any of that content we just would absolutely love sharing. So anyone here has anything that you'd like us to post across our social or add into our monthly emails from an NHS point of view, please do send that over, because we are here to be the conduit between not just the NHS and the private sector, but within trusts, because we know that you guys don't always have a lot of time to be able to knowledge share with each other. So this platform is here exactly for the same reason. So really appreciate that. Also want to say anyone who wants to share make any of those pledges, we do still have that link to the pledge page. And if you are doing anything for the Sustainability Day of Action within your trust, please post and tag us on Twitter, or use the hashtag Sustainability Day of Action, because we'd love to see what everyone's up to today as well. So I do have a question open for you, Anna, but I'm going to leave that to the Q&A session at the end, or if you want to type that answer in yourself during the rest of the session, that's completely fine as well. Next, we've got James. If you're ready to give us an intro to who you are, what you do, and what your presentation is on, James, I'll pass that over to you.
Perfect. Thanks, Georgia. Can you see the slides okay? Quick nod. There we go. Hi, everyone. Good morning. Happy Sustainability Day of Action Day and Healthcare Ocean Day, or Ocean Day, whatever Richard said. Lots of days, but reason to celebrate. My name is James Bates. I will be presenting the challenge of delivering net zero and sustainability as a whole across an integrated care system. Quick introduction, I work for the South East Greener NHS team as the senior project manager here. Passionate about tackling air pollution, increasing active travel, supporting primary care, and engaging and educating our workforce to raise awareness and encourage action across the health sector. But today I'll be talking all about integrated care systems and the various challenges and opportunities of how we can deliver sustainability at scale. So this is a brief agenda of what I'm going to be running through, and I'm going to be starting off by talking about what an ICS is. Some of you on the call may not be aware of the restructuring of the NHS. Looking at the different levels and then focusing more around the green plans and greener NHS agenda, focusing specifically on the challenges of governance from a top-down perspective, and then communication and networks from a bottom up. And I just want to end on some opportunities to help alleviate and mitigate these challenges through pan-system project delivery and regional support. So you might ask, what is an integrated care system, or an ICS, as I'll be referring to them throughout this presentation? And with that being said, one of the challenges of the NHS is actually working out what all the acronyms mean. So yeah, I'll try and avoid that as much as possible. In summary, an ICS is formed of a group of NHS providers and local authorities that are expected to work together and collaborate through a joined up approach. And there's approximately around 42 NHS, and there's 42 ICSs across the country. Now, restructuring the NHS isn't new. ICSs were previously known as sustainability transformation partnerships, and there was no legislation that actually encouraged these providers to generally work together within this model. There was a focus to compete rather than collaborate, so this often wasn't actually achieved. However, despite some of the negative press, the revised 2022 Health and Care Bill will make ICSs statutory bodies from July onwards, which will completely reform the way care is delivered across the NHS. The ICS is split in two distinctive parts. You've got your Integrated Care Board, or ICB, and they essentially just manage the funds and set the direction for the system. And then you've got Integrated Care Partnerships, or ICPs, that are formed of these different system partners of your secondary care, your primary care, your local authority organisations, and local anchor institutions. Now, the ICS model essentially mandates collaboration across secondary care. So it's looking at how acute, community mental health, social care, and ambulance trusts can work together, but it also incorporates collaboration within primary care too, which is a completely new phenomenon. And as mentioned, it's really important to work with local authorities, as local authorities have already established public health policies and implemented preventative measures, such as the copious amounts of work done in air quality. So given the many challenges facing our health service today, from depleting funds, overworked staff, COVID backlog, a completely inept government, working collaboratively to avoid reinventing the wheel sounds like the best approach to take. Although it does come with many challenges, especially considering the mammoth task of delivering net zero. Now, this is a snapshot of the structure of Buckinghamshire, Oxfordshire and Berkshire West ICS, or BOB as it's known. I've told you about those acronyms. And as you can see, this is how the ICS plans to deliver care at scale and closer to communities. So at the top, you've got your ICS, which is managed by the Integrated Care Board. And these are usually formed of old clinical commissioning groups. And I'm not going to use the acronym because it's getting a bit boring now. And then underneath that, you can see the Integrated Care Partnerships. And then it's looking at how we can deliver care to communities. Although it's worth mentioning that some ICSs are much more mature in their structure and organisation than others. And some are still trying to figure out what they need to do. So this discrepancy in development means that systems are at different stages of their journey, and this is best demonstrated in how ICSs are planning to deliver net zero. So I'm not going to watch this, it's 5 minutes long, I never intended to anyway, but the slides will be shared, and it's a really, really good animation by the King's Fund, all about how ICSs are structured and the future of healthcare. So if you do want to look back over these slides, it's worthwhile watching that animation because it's much more engaging than me whine on. So yeah, so I've talked about the challenge facing ICSs, but what does this mean for sustainability and delivering net zero as a whole? Now, you've probably heard of the National Green of NHS mandating that all trusts and ICSs have to develop and implement a green plan. And a green plan is basically the strategy document, the action plan to deliver sustainability. They were previously known as SDMPs, or Sustainability Development Management Plans. And it's important to note here that an ICS green plan is much more different to a trust green plan. And it shouldn't just be a collection of the various strategies, because what's the point in that? We should rather provide an holistic guidance on how NHS providers and local government can collaborate and work together to deliver sustainability at scale. I see it as an umbrella. How can the ICS bring all these different people together to avoid reinventing the wheel? Now, the challenge really is that trusts have historically worked independently from one another, and projects are completed in isolation. So therefore, the ICS really needs to set out how it can bring these different partners together to work in a more joined up approach, so that we can share best practice, that we can learn from local authorities and learn from what our trusts are doing down the road. Now, as you'll see on the right, another challenge is primary care. And Ben Rusholme, who's going to be talking after me, can vouch for this. And primary care has often been in the shadow of secondary care when it comes to sustainability. It's much more challenging than acute trust. There's no central team that can deliver it. And sometimes within an ICS structure, it's not given as much of a platform to deliver sustainability as other NHS organisations have done. Now, some ICSs have been really proactive. As you can see, the South East London has developed its own plan for primary care. However, this isn't reflected across the board. So even though the Green Plan guidance can say how ICSs can structure a net zero strategy, there are still questions over governance, delivery, questions over primary care, and essentially who's going to make these trusts work together when they've never been asked to do so. So you'll see on here, you'll find a draft example of a governance structure and how they're planning to deliver sustainability. Now, sustainability from the top is often seen as a tick box exercise, a nice thing to do. I mean, the Shine program, like Annalisa just said, have been leaders in terms of getting that top-down support. James Dixon, I think, put the book of Greta Thunberg on the desk of Dame Jaffe, but again, this isn't reflected across. We've got some trusts who didn't have a sustainability manager for 5 years, so we really need to ensure that we can embed it from the top and ensure that sustainability is embedded through the work streams, and this is paramount within the ICS structure to ensure that decision making isn't just within the bottom line, within cost and care, but it incorporates the CCC model, which I vouch for all the time. It's care, it's cost, and it's carbon, the triple bottom line as well. But how can we do this? How can we include net zero in the criteria of decision making? How can we sell the idea of the green agenda to ICS CEOs? And what on the screen is one example to do so. As you can see on the right hand side, we've got various working groups who feed into a steering group. who then feed into the ICS executive team. And essentially sustainability is managed within these various integrated care partnership estates groups. Now, you might say that sustainability has historically been in estates and it needs to be embedded everywhere. But this is just one example of how we can prioritize, how we can escalate, and how we can feed problems on the ground back to the board. Now, this is one example of embedding sustainability in work streams and trying to garner that top-down support. But what about bottom-up action? To deliver sustainability throughout, we need bottom-up support. We need communication across various networks and system partners. And one of the major components of delivering sustainability in net zero as a whole is all around behavior change. It's all around cultural transformation. And one of the guiding principles of an ICS is to encourage collaboration. So we network, we communicate with our system partners. It's important that we learn from one another and share best practice across the whole system. We need to adopt efficiencies from primary care. We need to gather research from academic institutions. I saw Jason in Southampton that was talking about some work that Richard can benefit from. And this is just an example of us working together. We need to drive grassroots action in collaboration with the third sector. And this is how the ICS working as one. It's not trusts doing one thing down the road and another doing one thing down the other road, both spending 5 million, both taking the same amount of time and both getting the same outcome. It's about bridging that gap and working together. Now, on the screen, you'll see these 3 different models. And on the right, this is what we want to strive for. We want everyone to work together within a transparent approach. We want people to be empowered to communicate with one another rather than doing it anonymously and having to work around the boundaries of NHS where you get in trouble for trying to ask somebody a question if that's not the right channel to use. No, we want to break down these things and we want to work collaboratively through an open and transparent approach. Now, the chain and wheel is good in some respects and good for reporting and governance, but if we're talking about networking and communication, we need to strive for that model on the right-hand side. So I've talked about the issues and challenges facing ICSs, but I wanted to draw upon some opportunities to mitigate these challenges. And my role within the South East Green NHS team is to work with the ICSs here that you can see on the left-hand side. And then on the right, you can see all of the ICSs across the UK. I'm based in the little green thing, which is nice for the sustainability agenda, but that wasn't intentional. And one of my main roles is to support ICSs implement their green plan. This is through funding ICS projects, facilitating discussion and collaboration, and assuring sustainability performance through aggregated carbon footprinting and various other assurance mechanisms. In addition, we've set up an implementation group that allows ICS sustainability leads to communicate with one another and raise concerns to the regional team. As like I said, it's vital that ICSs can discuss through open and transparent communications. And then one other way to encourage action through pan-system projects is through communications, campaign, training programs and infrastructure changes that can be delivered through various different trusts. So the ICS again can deliver net zero across the whole system. And one example of that, I'm going too far ahead, is through EV charging infrastructure. Now, I'm on board with Richard. We want to reduce the demand for driving. Electric vehicles aren't the answer. Active travel definitely is. However, obviously, we are looking to electrify the fleet. We've got community nurses, ambulances driving on our roads all the time. 4% of all road traffic is through the NHS. So we need to do something about it. And adopting a pan-system approach to electric vehicle infrastructure is one way to do that. We can work with local authorities, we can collaborate our acutes and our communities and our ambulance trusts, rather than each one developing their own strategy, each one having all of their own charging points with substations, which is so expensive. Let's work together on this. It makes sense from a financial perspective, from a sustainability perspective, from a care perspective as well. And where was I going with this? I totally forgotten. So yeah, work together, it's the best thing to do. And then lastly, the slide I wanted to talk about is one of the tools available that can encourage ICSs to work together. This is the North East and North Cumbria, and they are currently developing an ICS clean air framework, which again encourages that collaboration with local anchor institutions. That will be available at some point this year, hopefully before the Green Plan support tool. It will be available at some point this year, and it allows again trusts to develop an action plan on how, it allows ICSs to develop an action plan on how to tackle air pollution. So that's all from me. Thanks for listening. Apologies if I've gone a bit over. And if you've got any questions about the points I've raised, again, I'll be on the panel later, so just raise them then. I'll pass back to Georgia. So again, thank you, and I hope you have a good day. Bye-bye.
Thanks, James. And again, another really helpful and just pragmatic talk there from you. So I really appreciate all of your support there. We do have a question for you in the Q&A. Again, I'll pose that to you in this session, or you can answer it yourself, as Annalisa did. Touching again on the points around not reinventing the wheel and creating a more holistic and collaborative approach, exactly what we've always been saying. What I really loved was the triple C's being part of the bottom line, because I think even feeling like even a year ago, I think Nathan would agree that I don't think that the third C, being carbon, was on the same priority level as the other two C's, and we've just seen it just being like, okay, not just within obviously healthcare, but within the private sector as well, that sustainability is up there in boardrooms. It's on the agenda, and it's increasingly so, but we can't begin to have these discussions without being collaborative and sharing everything that everyone knows within all sectors. I would, if anyone's interested in hearing a little bit more about electrifying your fleet, we did have a guest on our Earth Day event last month from a company called Ace Tech, and those guys do a lot in the electrification of emergency vehicles. So if you want to go back and hear a little bit more about them, I would go onto our site and look at that roundup blog post there. Again, anyone wants to tag any pictures, we'd love to see everything on Instagram or on our Twitter account as well. Ben, you're up next, so I'll pass straight over to you if that's okay. Give us an introduction to yourself and what you're going to talk about today.
Yeah, thanks, Georgia, and thanks, James, for that nice shout out for primary care. As you can all see, I'm GP. I'm in my consulting room today, which wasn't originally the plan. I was stuck in Paris for a few days because my train got cancelled, so I'm just catching up. So I'm currently down in Southampton. I've been here about 10 months since finishing my training. I'm one of about 28 staff here, and it's a kind of mid-sized surgery, a fairly small catchment with about 8,000 patients in it. And I'm part of a network of GPs all over the country that have an interest in planetary health. And you've probably met some of them already, part of the Green Practice group. So I wanted to briefly mention some of those impacts of climate change that we are already seeing in general practice, because this is something that clearly affects everyone. It affects the ground that we grow our food in, it affects the water that we drink, the air that we breathe, and of course it impacts upon the homes that shelter us. And we already feel that heat stress during heat waves here at the surgery on particularly hot days. So actually, if you come and see me, if you come to visit, this is a good room. Come to consulting room number 5. Avoid rooms 1 to 4. They do get really hot. But I can tell you a bit more about our plan to address that later if you like. But in particular, this is something that affects the most vulnerable in our community. And it affects us here significantly, but it's already affecting those in the global south, of course, much more, and affecting those that have the least responsibility for the problem. But when it comes to general practice, I think air pollution is perhaps a really good example, because we see almost every day how that directly affects people with lung disease. And there's been some really good research done locally here in Southampton. We know that the children in our local area have a shorter life expectancy because of that air pollution. Here in general practice, we're also quite well placed to observe the social impacts of global heating, the hours of work that are lost due to climate-related ill health, the people that is displaced by flooding, to name just two examples. And it seems to me, over recent years, we've just become increasingly aware of the environmental impact of our work. That NHS reports showing what a significant carbon footprint we have, 24% of the NHS's carbon footprint. In particular, for example, we prescribe a lot of medicines, and that makes up the majority of our carbon footprint. Perhaps, say, you use one of those metered dose inhalers, prescribed again and again on repeat by a well-meaning GP like myself. But those small canisters with very potent greenhouse gases, well, they all add up. And so we're taking steps here at my surgery and in every surgery across the country to try and change our prescribing accordingly. But we're finding changing medicines is not easy. You know, it's done one drug at a time in consultation, discussing all the pros and the cons. But we know we do have to take action now and do so in every part of our work. And I know that just the few consultations I did this morning will have had a significant impact on the environment. Yeah, I may not have come in this morning and burnt a load of fossil fuels. I wasn't shoveling any coal. But I know I've prescribed a lot of medicines. I've used some gloves. I've used some of these single-use plastic thermometer probe covers, for example. So what sort of action are we taking? Well, we're trying to reduce our energy use. We generate our own renewable solar energy up on the roof, which you can come and admire if you like. We are looking at staff and patient travel to and from the surgery, and we've just created a facility for some cycle storage out the front. And where we can, we're trying to reduce our waste, recycle things where possible, wearing these reusable face masks rather than the single-use plastic ones. So switching to reusables where they're available. I want to wrap up quickly, but I want to give you a picture of what a future for primary care might look like. Because I think there is huge potential in a sustainable approach to primary care, a real win-win both for health and for the planet. So imagine with me for a moment a future where in your local community, perhaps just like your GP, you got some exercise cycling to the surgery, and then you notice while you're doing so that the air you're breathing is cleaner. And once there, you have just the blood tests that you really need. And then those samples, perhaps you see them getting whizzed off up to the lab in a small electric vehicle. Maybe your asthma is much better controlled, having switched to a dry powder inhaler. And then when that's empty, you can drop it off at the pharmacy where it gets recycled. You may notice your family's eating less meat, but feeling the health benefits of a more plant-based diet. Say this evening, you'll go for a walk in the local park where nature is just thriving. Does that sound good to you? I hope so. Let's hold on to that feeling, please. Let's make it a reality. So I'll leave you with a final thought, perhaps, that if we look after the planet, it'll look after us. I look forward to the questions.
Thanks, Ben. I do appreciate, as I said before, you taking your time out. I know that you're stranded. Paris is not the worst place to be stranded, but I really appreciate you taking your time out today to be with us. And it's something that we've talked about before, and it is that vicious cycle of people are iller because of the air pollution, and therefore there's more strain on the NHS, and therefore there's more air pollution because the NHS has to look after more patients, and there is that vicious cycle, and there's so many different ways of trying to break that cycle that you've mentioned there, and how everything just works so intrinsically together for that brighter future. So that is a really, really positive and nice note for you to end on there as well. If anyone does have any questions for Ben, he will be with us in the Q&A session. We are running a little bit over, but that's always completely fine, because we do have another half hour for questions after we have had our discussion from Susie. So Susie, if you want to please share your screen, give us an introduction, who you are, what you're doing, what you're going to be talking to us about today.
Sure, will do. Thank you very much. And sorry to have been the mystery presenter. I'm not quite sure why you didn't know why I didn't pass this on. But anyway, thank you very much. Really good to be here and great to hear. It's a really lovely, really good variety of presentations that we've seen so far. And I'm here providing a sort of the provider level perspective, I suppose. So I'm Associate Director of Sustainability at Sussex Community, and I lead the Care Without Carbon team. We work within Sussex Community, but actually more broadly across Sussex with other trusts as well. But I'll explain a little bit about that and our journey in this presentation. So first of all, just a little bit of context about Sussex Community. We are a community trust that has grown considerably, as a number have across the country as a result of the pandemic. So we've been involved in the vaccinations programme in Sussex. So these stats here are actually considerably higher than they were a few years ago, certainly in terms of our staff body. So about 8,500 staff delivering services across 70 sites in Sussex. So as a community trust, we obviously have quite specific challenges in terms of travel and other areas in relation to carbon. We've been working on sustainability at Sussex Community for a long time now, and the programme actually began back in 2010. And in 2014, we developed Care Without Carbon. And Care Without Carbon was developed as a sort of framework for delivering sustainable healthcare. That was all about how we deliver high quality care with as low as possible impact on the environment. So it does what it says on the tin, really. And it was about trying to frame sustainability in a way that people would understand and that would cut through the usual communications within the NHS, of which we know there are many. And at that time in particular, but also true now, I think the word sustainability itself had so many meanings depending on who you were, and often it had a sort of financial meaning. So we developed Care Without Carbon to explain what we meant by sustainability and to really try and bring it up the agenda and make people interested in what this might be all about. The programme has developed over the time, but core always has been these three key aims, and we've heard about the CCC before. This is the same effectively. So everything that we do within the programme is trying to, yes, reduce our environmental impact, but also at the same time improve well-being, whether that's of our staff or our patients, and also fitting in within the sort of financial sustainability as well. So really thinking about investing in the future. And the kind of classic example that I quite often give as a community trust, which is really relevant, is about, say switching to bike. So if you can get staff out of their cars and onto their bike, you're reducing your environmental impact through carbon emissions and air pollution. You're improving your well-being in terms of mental health and physical health, and you're obviously saving money on petrol. So that's a real sort of classic example. And I'm just going to show you a quick video here, which shows what that looks like in practice with one of our health visitor teams. So hopefully this will load. Can you hear that at all?
We can't hear the...
No, okay, that's a shame. All right, I can't hear it either. I'm not quite sure how to fix that. I'll pause it there then, but it's a lovely video, and it's what I love about it. It's one of our health visitors visiting maternity patients in their homes, and it really shows the well-being aspect in particular of getting out on your bike, and actually the fact that patients really love to see that. So I recommend having a look at that after this if you can. So apologies for the sound, I'm not quite sure what that's about. So we've kind of, within the sustainability work that we've been doing at Sussex Community, we've covered a huge range of different areas over the last 10 or 12 years, and you can see a few of the examples here. So we've obviously been focusing on carbon reduction opportunities, but also looking much more broadly. So reducing the impact of our fleets, introducing low emission vehicles across the board, integrating sustainability criteria into tenders, and we've been working on that for a few years. It's really interesting to hear Annalisa talk about their work at in Newcastle, which is really exciting on that front as well. A lot of programs around reuse and staff engagement in particular has been really critical for us. But one of the things I wanted to draw out in this slide was actually that sort of on the bottom line, the ones around working in partnership with others, and actually that's been really key to our approach here in Sussex. So as a team, we work within Sussex community, but also with other trusts locally, delivering either sustainability programmes or projects across the board. So we're working with nearly all of the NHS Trust providers in Sussex and some further afield. And really, we've found so much value in taking this approach in lots of different ways. Trying to maximise our impact overall, but also avoiding duplication, sharing our learning and the specialist expertise that we've been able to build up within the Care Without Carbon team across Sussex, and having sort of been through the process of developing green plans with our partner trusts over this last period of time. We've learnt so much in all sorts of areas, whether that's sustainability or otherwise, from working together. And I think that's really been a real benefit of our approach down in Sussex. And we've also delivered some joint projects through using the regional accelerator funding, looking at carbon footprinting our inhalers, which has been a challenge, but a very interesting one. Developing a climate impact assessment for Sussex to understand how climate change is already and will be further impacting us and our patient populations, and also looking at things like engagement at ICS level. So really, we found a lot of value in working together on sustainability within Sussex, and it was good to hear James talking about that from the ICS perspective earlier. And what I just wanted to talk through, I suppose, a few of our key learnings and sort of how we've tried to approach things over this last period of time that we've been working on this. And so taking a data-driven approach has been really critical for this. It sounds quite boring, but actually, in sustainability, when there are so many different areas of work to look at and to think about, you need a way of prioritising. So taking that data-driven approach is really critical in order to make sure that you are tackling the most important issues and that you're able to focus your resource in the right direction. So actually understanding your own carbon footprint in detail is important in order to be able to then identify how you're going to prioritise action. So it's linking your carbon footprint to a clear strategy, and then that is, we've heard about it before, but it's about reducing first, so minimising that resource use in the first place, then switching to greener alternatives. And we also know from this kind of analysis that actually it's around 80% of our carbon footprint is driven by clinical decisions, and therefore actually engaging across an organisation is critical to be able to achieve any of the reductions that we have signed up to as an organisation. And we've done that a lot. We've learned a lot about that over the last 6 years, I think, in particular. So we launched Care Without Carbon in 2014, and then in 2015 we launched Dare to Care, which was the engagement programme associated with it, and that was really about taking a kind of positive approach to engaging people on sustainability. It was a sort of pledge-based platform. It's a website that you can look at. So if you're interested, go to carewithoutcarbon.org and you can have a look. But we've sort of evolved that over time. We started with the pledge platform back in 2015. Then we've developed it into team challenges, specific campaigns based around sort of days that happen globally. So you can see that in the top right, that's something that we run in September called Travel Smarter September, which is all focused on air pollution. And we've also developed champions toolkits as well. You can see that on the bottom right there for those that are really interested in getting into things in a more in-depth way. So that's what we've been doing over the last 6 years or so, but we're over as a result almost of sort of developing our green plans. We're going to be looking at that again to see how we need to develop that. And I think there's a clear steer now that we need to move into a much deeper level of engagement with people. We've got that kind of high level. People roughly know what net zero is and need to reduce carbon personally, but actually this is critically about driving this into core business now, and helping people to understand what this means in practice, or learning with people across the board what this means in practice. And so to sort of support this, I suppose, we've developed our framework, Care Without Carbon framework now, to be much more focused around healthcare, and these sustainable healthcare principles at the bottom in particular are really about saying, actually, there's a lot of what's going on within NHS Trusts is already going in the right direction in terms of sustainability, whether that's your transformation programs or your QI processes to reduce waste and duplication. All of that is really critical in reducing our impact in the first place, as are our programs around health prevention or supporting our patients to have healthier lives, because of course the fewer patients that need to come through the door, the less resource we need to use in the first place. So this is about sort of looking upstream and saying this isn't just about switching from one item to another, that's less carbon intensive, but actually about looking at this across the whole piece. And so finally, the sort of what's next for us. I won't go through this in detail, so I'm aware of time, but just to give you a sense of what this is looking like. Obviously, the pandemic has had significant impacts, so tackling single-use plastic, PPE and waste segregation is critical, as well as really maximising this move towards agile working that we've seen over time. A deeper integration into clinical side of things, in particular through a new engagement programme, and of course meeting our net zero carbon commitment. And then finally, really developing the work that we're doing with our partners. We're in a great position in Sussex in that all of our provider trusts are doing really interesting stuff. And actually, right now we're working out how we embrace that at ICS level to really try and make the most of that opportunity that we've heard a little bit about already. So I will stop there, but look forward to hearing the discussion in a minute and hearing if there are any questions.
Thanks, Susie. It's so great to hear about what you guys are doing at Care Without Carbon. And I think that, everyone who's talked today, it just shows how much work there is actually going into, the same sustainability goals. And I really loved your campaign around making things positive, because everything that I think that a lot of people hear a lot of the negativity around sustainability and just switch off because they feel like it's being demonized, whereas spinning it around to be much more positive, in terms of what you can do, that's really great. And also the data-driven approach, everyone talks about that. Annalisa had, her great platform. We did have another, again, in our our Earth Day webinar that we did last month. We had N0, that company that have a great platform as well around tracking your sustainable goals, because you cannot change what you're not tracking. You need to have that baseline, you need to understand what's happening to be able to make any sort of change. We did have some questions. I think, Annalisa, someone tried to ask you a question, but you weren't actually able to. It still says that you're trying to type. I'm not sure what happened with the Q&A functionality there, but why don't we go ahead and ask that question? Richard says that he's going to be able to contribute to that as well. So I'll give you the floor on this. Does net zero mean net zero in greenhouse gases or in all emissions, such as pharmaceutical pollution that Richard discussed?
Yeah, thanks. I'm not sure why I wasn't able to type a response, but yes, thanks, Alan, for the question. And I'll just try and clarify. Obviously, I rattled through that presentation so quickly. Suppliers are facing multiple expectations from the NHS and from their other customers as well. But our 5-step net zero carbon framework is specifically greenhouse gases, carbon dioxide equivalent CO2e. So it does specifically focus on that. And the reason for that is within our climate emergency strategy, we have a vision and we've 3 sets of goals. So we have got a net zero carbon goal, we've a net zero waste goal, and we also have clean air and air pollution goals as well. We don't currently have a goal for water pollution. However, this is why it's actually probably easier that I answer this rather than try and type it. However, in addition to the framework that I presented, there's obviously lots of other work streams going on that will in turn relate to suppliers. So we have got a wider sustainable procurement working group, and we're looking at how we build in wider social value and sustainability considerations into the tendering and the contracting processes. We've also just started conversations with our pharmacy team as well. So we're looking at integrating sustainability into the decision-making processes and into the formularies as well. So I think the other thing just to mention is that the NHS E&I Evergreen framework that I made reference to has more expectations for suppliers than our simple 5-step process. And step 1, which is level 1 in theirs, which is called SEED, is that you report your carbon emissions and have a target. But as you move up the levels to level 2 and level 3, there's other requirements in there. Now, they still don't have water pollution or pharmaceutical built into that, but I think what we can do is embed these extra requirements into these existing frameworks. And as mentioned, I'm quite keen to pick up with Richard, and he's offered to answer chip in with this answer. But Richard, I think you and I should put our heads together to see if we can pilot something in Newcastle about that. Hopefully that
thanks.
part answers it.
Yeah, thanks, Annalisa. I think it's all about understanding the goal. And carbon has become obviously what we predominantly measure. And therefore, that's where we've been given our goals. If our goal is net zero for the planet and we marginalize everything else, then we will fail. Simple as that. We have to see carbon for what it is. It is one element of pollution. CO2 is a pollutant, as is methane, as is our inhaler drivers, as is our volatile anesthetic agents, as is our plastic, as are our drugs. They are all pollutants. And therefore, we've got to see carbon in that context of planetary pollution. Once we view it as one element, then we can have equivalent work streams for all the other elements, because otherwise you can't capture everything within the goals that we've set. So I always think, what is our goal here? And I posed this to the shipping industry at COP26, and I thought I was going to get beaten by sticks at this point, but luckily not. But I asked them what their goal was, and they said net zero. And I said, well, why net zero? And they said, because we've been told to. But then actually what our goal is a healthy planet. We've got to re-establish a healthy planet. We've got to restore nature and biodiversity and biomass. And if we do not do that, then we won't have a planet to live on, regardless what our carbon output is. And once you see that goal and you have that vision in your head, and then you imagine a growing population existing in that healthy ecosystem, then you can visualize where we need to be.
I think that's kind of what Ben was, the beautiful vision that he had sort of put in our heads as well, and it's that holistic piece. Ben, or any of the other panelists, do you have, because we've all talked a lot more about like a holistic view, do you have any other ideas of how we can communicate a healthier planet as opposed to specifically on that carbon piece?
I think it's an interesting one, and it's pretty critical for lots of reasons, I think, as we've heard about. Because the other thing is that it's interesting, Annalisa, hearing those sort of three goals, because actually when you look at the carbon footprint, of course, something like waste comes out as pretty tiny compared to others. And of course, for lots of reasons that we've heard already, waste is really, really critical from an environmental perspective, but it's also critical from a staff engagement perspective, because we know it's the one thing that everyone kind of recognises. Everyone recycles at home, and so you think, well, why can't we do it, in the office or in a hospital? So actually, when we're thinking about how we prioritise, it's kind of a combination of different things, I think, and I've sort of talked about that data-driven approach, but what we kind of look at when we're prioritising our work is a number of different things, and actually how to engage our staff on this is really critical as well. So making sure we are aligning with some of those things that are outside of the scope of net zero is really important. But I think it's a difficult challenge, because of course within the NHS we're often when you're trying to push change, board members, etc., are interested in what's the kind of regulation behind this, what do we have to do, as well as, of course, there's the wider benefits there, but they are really interested in that. So I think it's also going to be important that over time there are regulatory drivers that are set in these areas as well. We know that there's kind of stuff coming along around biodiversity and that kind of thing, so that those things will come. But actually, we need those drivers to come externally as well, in order to really be able to progress these, to building the business case.
Sorry, can I just chip in there, Georgia? Obviously, my feelings on this, and it's about awareness of what's going on in the world, where Richard's kind of highlighted it, is how many people actually understand this. How many people are aware of what's coming in the future, and does it have to be, you don't have to be a big corporate. A lot of people thinking these corporates are going to solve this, or the government will sort it, it's all getting sorted, but it doesn't. It comes down to kind of individuals, and even down to grassroots and kids in schools, in healthcare. If you run a business, or educating your staff, I think if everyone becomes more aware, then they can make those small changes. Even just like Annalisa's presentation with Johnson & Johnson doing the carbon report, but also on there was ZMove. ZMove, we've spoken to them before, like a tiny little company just running around things on electric bikes, and I'm not sure what their carbon saving is for that trust, but it's significant. And just making those small changes, whether it's a simple product or kind of in massive corporate, changing gases or some new invention, it's every little thing that everyone does in their life can make that change. But the most important thing is knowing, understanding what what lies in the future. Right now, the ice caps are melting, and that's clearing way for more shipping channels. So as those ice caps clear, there's going to be more shipping. So if you're procuring from China or wherever, you know, buying your clothes on Amazon and whatever everyone does in everyday life, it's going to increase that shipping. So it's having that knowledge and that understanding. And there's plenty of documentaries out there. So it's whether you actually care as a person and want to understand. But equally, that education is important throughout, whether it's, you know, in society, in school, in businesses. Everyone needs to understand what's coming for the future of their kids and grandkids.
Thanks, Nathan. Ben, did you want to jump in?
I was just going to say that my experience in primary care has been that it's so important just to go where the energy is. Whilst clearly we just need to stop burning fossil fuels, and there's ways that we can have a direct impact on our energy use. Actually, if everyone at surgery is more interested in recycling and that's what they're focused on, then go with that, because that's going to lead to a discussion and more sort of thinking about what is it that we care about, why do we want the planet to be healthy, and then further changes will come, because we need to be making changes in every area. So if there's energy in one place, then that's where we need to go, and that's what I found that works best and gets people talking, gets people engaged with this.
Well, there's actually a question for you specifically about this, Ben, and it's around as a GP, how do you communicate to patients and others the impacts of air pollution can have on their health?
Yeah, it's something that we're getting used to talking about in consultation, and at first we're all a bit rusty on it. It's not something that we're taught, it's not something that we're used to talking about necessarily, but it's something that with time and with practice, I found that I've got better at it. I guess it's a bit like doctors getting used to talking about the effectiveness of medicines or the cost of medicines, and those are quite routine things that we build into our consultations now. So talking about the environmental impact of medical treatments or the impact that the environment's having on someone's health is something that clearly is important to be discussing. And I think it comes quite naturally into most consultations, or it's something that patients are interested to hear more about, or it's something that they've wondered about themselves. I certainly haven't had any negative reactions when it's been discussed.
Georgia, can I just come in there? So my previous role was with Global Action Plan, the people behind Clean Air Day and that ICS Clean Air framework. And some of the projects that they're working on is exactly that. How can primary care health professionals speak to patients about air pollution? How can we embed it in existing consultations? Because health professionals, respiratory, pediatric, primary care, they've had no training at all on air pollution, and the health impacts of air pollution just hasn't been included in the curriculum whatsoever. So because people aren't being educated or trained, it's just not being delivered. So there is a lot changing, like Ben stated. I think a lot of GPs are on board with this and have correlated the impact of air pollution with asthma, other respiratory illnesses, cardiovascular, for example. But at the same time, there's also tools being available as well. You've got the Primary Care Respiratory Society, and you've got the Greener Practice Networks. Global Action Plan are developing in-person and online materials via their Clean Air Champions framework. So more is happening, but again, within primary care, everyone's so busy, everyone has different priorities. So again, I echo Ben's views in that it is quite hard to embed, but yeah, there is stuff out there to support that.
And Richard, you've got your hand up.
Yeah, I just wanted to pick up on a couple of things. One is that Susie, I think your second to last slide, I would love that, because there was some beautiful stuff in there about maintaining health. Obviously, the lowest carbon healthcare is that which does not need to take place. And you had some lovely bits in there about environment and things. So I think that's really important, that kind of holistic approach. The other thing I'd say with respects to following the energy, Ben, is sometimes the energy is directed in the wrong direction, and that's what we've got to be a little bit cautious of. We have got a lot of energy around carbon, but we've got to realise, the place of carbon in the overall equation. And there are certainly some academics that very firmly believe that climate change has been driven largely by pollution, and carbon being one element of that. And I didn't really get time to explain in my talk, But if you've lost 50% of oceanic biomass in 70 years because of pollution and forever chemicals, so your +4 carbon into the ocean per year has gone to +2. If we'd have still had +4, then we wouldn't have climate change as we know it today, because we would have a far healthier ecosystem, which would be able to help us mitigate through natural systems. So you're right, we have to capitalize on things such as waste streams. Absolutely. You know, if we get people recycling at home and repurposing, brilliant. Let's take that energy and build upon it. But sometimes, and this is the journey we've had with Healthcare Ocean, where it's taken us 18 months of going, excuse me, what about the oceans, to get any kind of traction, because nobody was thinking about it. So sometimes we do have to challenge where the energy is directed.
And there is one last question, Ben, about if you've seen the WISE list developed by Stockholm County Council that incorporates environmental impact into their formulary for prescribing.
I haven't seen the WISE list specifically. Just looking out at it, I'm going to read into it a bit more. It looks really interesting. But I am aware that a formulary is being developed in the UK with the carbon footprint for sort of every single commonly prescribed medicine, which I agree is going to be absolutely essential, so that we can add it all up and see exactly how our prescribing is impacting the environment.
Okay, I've only got a couple of minutes left, so I am going to have to cut you guys off because I've got a couple of more bits that I have to talk about before we end. First of all, if you're doing anything for Sustainability Day of Action, again, please tag us across social media, Instagram, LinkedIn, Twitter, hashtag Sustainability Day of Action. I would love to see what everyone's up to. If you do have any pledges to make, we'll post that link again if you want to go ahead and make your pledge on our Sustainability Day of Action pledge page. We'd love to hear from everyone. Let me just post that there. And we have our second webinar this afternoon. So we don't normally do 2 webinars in a day, but because it's our flagship day and it's Day of Action, what we've decided to do is we've had all of our great NHS and healthcare experts this morning talk about their journeys towards a more sustainable future. The session that we have in the afternoon is more from private companies and suppliers to the NHS to talk about what great solutions that they've come up with and how they're building towards a more sustainable supply chain into healthcare. So if anyone wants to sign up to that, it is still open for anyone to, I'm just going to try and get the link for that as well, so that you're able to come and join us again this afternoon. Here is the link for that session. This session has been recorded. We'll get all of the resources that everyone's provided us with. It'll all go onto one blog post onto the Sustainability Partnerships website in an event write-up. I will have links to everyone's credentials, contact details, all that kind of stuff that you need to get in touch with and create more collaboration with our amazing panel today. So with nothing else to remind everyone about, hopefully I will see you this afternoon. If not, we'll see you on the next event that we are running, which is around the circular economy, around plastics within the NHS. So NHS Plastics and the Circular Economy, that's our next one up in July, so not that far away. So we've had so many people in today, so much conversation within our chat today as well. So thank you so much to everyone who visited us as a delegate, and obviously thanks for all of your time, all of your enthusiasm and your passion, everyone on the panel, I wanted to go in order, but to Richard, to Annalisa, to James, Ben, Susie, I'm pretty sure that's the order that you went in today. Thanks so much for your time, and hopefully we'll work together on some things again in the future.
Yeah, thanks guys. Thank you, George.
Thanks everyone.
Yeah.
Speak to you soon.